welcome to another interesting edition of our program, The Health Matters, a program that is designed to ensure that you live a healthy lifestyle, a program that is put together to make sure that you get the necessary medical attention and to know what is wrong with you at the right time and where to go to. Alright, today on the program Health Matters, we are going to be discussing on the topic rubella. I'm very sure many of us would have heard about this disease. It is measles, another kind of measles. So I am not going to do this alone because I do not know much about rubella. That is why in the studio with me is a health expert who is going to do justice to the topic rubella. She is Dr. Etorabasi Akanimo, a resident doctor from the Department of Community Medicine, University of Uyo Teaching Hospital. You're welcome, doctor.
Thank you very much. Thank you for having me.
You're welcome.
Thank you.
All right, and I also welcome you once again to this very interesting topic. I am your anchor, Utabi Achibon. All right, you may have been hearing about measles, and of course you have a fair knowledge of what measles is. But today there's another kind of measles we are going to talk about. Like I said earlier, it is the rubella. So our doctor here in the studio is going to tell us what you should know about rubella. Okay, you're welcome once again to the program, Doctor.
Thank you.
Etorabasi. Can you just briefly tell us, our audience, viewers, about what rubella is in a layman's language?
Okay, I like that one in a layman's language because we have a lot of our medical
terms.
Okay, so rubella is a viral contagious disease. So first I'd like to say that measles and rubella are kind of twins. Many times a child or a woman can have rubella and it's mistaken for measles. So rubella is a viral contagious disease. It means that it can be transmitted from one person to the other, okay, and it's caused by a virus, and it is transmitted by coughing, sneezing, so respiratory droplets. If a person who has rubella sneezes or coughs, the person can transmit it to another person. So it is transmitted by respiratory droplets. Rubella is a viral contagious disease that is characterized by low-grade fever and rashes all over the body. So that's basically what it is in a nutshell. It's otherwise called German measles, and sometimes actually mistaken for measles. Now the truth
doctor, let me cut in the characterized by
fever, low-grade fever, yes, rashes.
But I also know that the measles we know here in Nigeria also have those symptoms. Beautiful. So how do you differentiate? What action should you take? What are the pointers for you to know that this is actually not the measles we know? This is rubella.
Okay, so one of the things is that rubella is a milder form of measles, whereas measles would give high-grade fever, and by high-grade fever I'm talking about temperature from 39 degrees. And just to say, if you're a mother at home, please, it's important for you to have a thermometer at home. Because anytime your child is ill, your hand is not a thermometer. The back of your hand is not a thermometer. Please use a thermometer to objectively know the temperature of your child. So back to the question. The difference is that whereas measles causes high-grade fever, so from 39 degrees Celsius.
I was coming to that.
Yes. So rubella would have low-grade fever. In rubella, there is low-grade fever. So let's say 38 degrees Celsius, about that. And also in measles, there's dry cough. And sometimes what we call Apollo, conjunctivitis, okay? There's redness of the eyes, there's cough, whereas in rubella there isn't cough. And the rashes can want to look the same, but in measles the rashes are more together, while in rubella the rashes are more widespread. But it can be mistaken, and that is why you need to go to the hospital if your child is ill for proper diagnosis, not the pharmacy.
All right, doctor. There's a key word you used there, that all mothers, parents, caregivers should ensure that they have thermometer in their house. That in the back of our palm.
Yes, it's not a thermometer.
Because, of course, as mothers now, once you just feel the temperature of your child, you're like, my baby is running temperature.
Exactly.
Before you know it, some of us will just administer paracetamol.
True.
Okay. So as a mother, you need that thermometer in the house to ensure that your child is well.
Yes.
All right, you've helped us to know the symptoms, pointers that differentiates between rubella and measles. All right, I hope we get that. Doctor, thank you very much.
Thank you.
And I also read, while I was trying to find out what rubella is, that it's more dangerous for pregnant women.
Exactly.
How is that? Why?
So when a pregnant woman has rubella, now first off, remember that I mentioned that rubella is a milder form. So when it happens to children, it's mild. Okay, but when it happens to a pregnant woman, the pregnant woman has a tendency to transmit the rubella to the fetus, so to the baby inside the womb. And unfortunately, rubella in a pregnant woman who was not vaccinated, and that's why we're going to come to the immunization campaign that is ongoing, can cause a miscarriage. It can cause what we call congenital abnormalities. Congenital just simply means problems that happen in the womb. So these congenital abnormalities could range from deafness, the child could come out not hearing. It could range from even blindness, cataract. The child would have a problem, in the eyes.
It's a fetus in the womb that is more susceptible, not even the mother.
Exactly. Not even the mother. So it's the problem that comes because it's transmitted. So aside from the fact that when a person sneezes or coughs can get rubella, now in the womb, if a woman comes down with rubella, she can transmit it directly to her child in the womb, and it is very, very, very harmful and dangerous. Yes, so there can either be a miscarriage, or the child would come out with different birth defects, even heart problems, to eye problems, to ear problems, and no child or no mother wants to give birth to that kind of child.
All right, thank you very much, doctor.
Thank you.
Thank you for still being there, and if you are just tuning in, this is Health Matters on NTA Channel 12. We will be back shortly after this time out.
While typically a mild self-limiting illness in children and adults, rubella poses a severe risk to pregnant individuals, causing miscarriages or serious birth defects known as congenital rubella syndrome, with devastating consequences, especially for pregnant women and unborn babies. Health experts warn that rubella poses a serious threat when contracted during pregnancy, particularly in the early stages. This severe birth effect can lead to heart abnormalities, hearing loss, vision impairment, and developmental delays in affected babies. Women planning pregnancy are also encouraged to visit health facilities to check their vaccination status.
They will carry and go to hospital. You tell me what I want to do. If I have money, I will do it.
I want to advise all pregnant women to take their antenatal clinic very seriously. They should take their vaccine, tetanus toxoid, meet a doctor, and not just stay in the house. They should avoid herbs and other unprescribed medication, over-the-counter medication.
Medical Director, UUTH, Dr. Emema Basibasi, is advising parents to ensure children get complete routine immunization schedules.
Rubella is actually German measles. It's a bit milder, than the normal measles. Rubella is caused by a virus. But if it affects a pregnant woman, it can actually have devastating consequences.
He emphasized that vaccination remains the most effective way to prevent rubella and stop its spread within communities.
It's a mild disease in children, but because of its effect in pregnancy, it's a matter of serious public health concern. And because of that, you have the rubella vaccine. The rubella vaccine is actually available, and it's usually given in combination, what is called MMR, mumps, measles, rubella. So the public needs to be aware that this vaccine, is available in virtually every health center, every government health center, every general hospital, and even in the teaching hospital.
Health professionals further stress that increased public awareness and improved vaccination coverage will help prevent rubella and protect future generations from avoidable birth defects.
All right, so welcome back to this very interesting program, The Health Matters, that looks directly to your health. It deals with how you can stay healthy and be wealthy. Of course, you know that it's a healthy person that can be wealthy. So let's go back to the topic of today, rubella. And of course, Dr. Itorabasi Akanimo is still here with me in the studio. And so far, we've talked about the symptoms, how you can differentiate between the rubella we are talking about and the measles, you know. So now we are going to look at how this disease can be treated. What are the treatment options? And before that, please, doctor, you're going to tell us how it can be prevented. How do we prevent it?
Okay, so the prevention is actually very important. Prevention, they say, is better than cure. And as a preventive doctor, I mean, I'm a preventive physician. I usually would advocate for prevention. So one major way to prevent rubella is through vaccination. Okay, so good enough, there's an ongoing program, measles rubella campaign, where different vaccinators go to churches, to the mosques, to schools, to even your homes. Every child from 9 months to 14 years should be vaccinated. Yes. Aside from the measles vaccine, you receive your routine immunization. Even if your child had received measles vaccine, please let your child receive that vaccination. So vaccination is one of the preventive measures for rubella. And the reality is, once a child receives that vaccine, he or she is most likely never to have rubella in his or her lifetime, because it confers a lifelong immunity. Okay, and so the idea is that if every child is vaccinated, when the young girl becomes a woman that is pregnant, she wouldn't even have rubella, okay, to even transmit it to her child. And also for the young men or the boys who are being vaccinated, if they're vaccinated, they won't even have it to transmit it to maybe their wives and their partners. So please, it's very important that we allow our children to get vaccinated. Don't listen to what people are saying. The vaccines are safe and the side effects are not outrageous.
What are the side effects?
So yeah, the side effects. Okay, first and foremost, this vaccine is given by an injection on the left upper arm. Okay, so the side effects are majorly simple side effects like pain at the site. One, of course, when they took injection, you have pain. So pain at the site, and sometimes maybe a bit of swelling, maybe depending on the technique of the person that gave the injection. Maybe a little bit of fever and little watery stool. But trust me, after 24 hours, 48 hours, these side effects will wane off. So it's not something that will be dangerous to your child. Yes, and it's not any foreign plan to depopulate Africa. Let's stop all these myths. Vaccines are good. So please let your children get the measles rubella vaccine. Thank you.
What about the pregnant mothers?
Okay, so no, right now, so this vaccine is what we call life attenuated vaccine. It means that it's like giving somebody the live virus, and the body would mount up an immunity, and that immunity will prevent the person from not contacting the disease afterwards. So it means that it's like giving on the live virus. So you shouldn't give to pregnant women. It's not for pregnant women.
Really?
Yes, it's not for pregnant women. It's for children between 9 months and 14 years, and it's also not for children that have certain what we call immunocompromised diseases like HIV, because it could further affect their immunity, because their immunity is already down, and this vaccine is life, and it can further affect their immunity.
That brings me to the next question, doctor. People with HIV and other serious chronic infection are not supposed to take this
Yes.
vaccine.
People with immunocompromised diseases or states.
Apart from HIV, what other?
Okay, so usually other things that can cause immunocompromised states are people that are on chemotherapy.
Okay,
Yes.
like cancer.
Yes, cancers. So yes, so and there are children that actually have cancers and are on chemotherapy. So we want to really, we wouldn't want to give them this vaccine not to further reduce their immunity.
All right, doctor. Thank you very much. You have said so much, and you, our viewers, I hope, as you usually say, the word is enough for the wise. But before we let our doctor go, she still has to say something, and that is very important. If you feel like your child should not be given this vaccination for fear of whatever, she had explained also that it is not myth, it is real, and we need to do this to save our child. Okay, ma, children. Okay, doctor, where do we go for this vaccination? And how
Okay.
do we get them? Apart from the schools, are they designated areas? And after now, what happens?
Okay, so because it's a campaign, it has a duration of time, and the campaign just started sometime this February and will be ending very soon. So where you can currently get the measles rubella vaccine are at the primary health centers. So it would make sense to visit a primary health center close to you. They are scattered all over town and all the local government areas of this state and in this country. So ensure that you take your child between 9 months and 14 years to a primary